Hello everyone, welcome to our channel Simple Nursing Notes. First aid रो आउ जितिकी भी क्वेश्चन आंसर बाकी अछि आमे एई वीडियो टिरे कवर करि नेबा. ओके चलो हमर पाठ पढ़ा स्टार्ट करि नेबा. नंबर 47 abuser physically, verbally or sexually assaults the victim. Tension building phase, incident explosive stage, honeymoon stage. The answer is B. In incident explosive stage, abuser physically, verbally or sexually assaults the victim. Number 48. Abuser emphasizes how much they love the victim. Options are tension building stage, incident explosive stage, honeymoon stage. The answer is C. In honeymoon stage, abuser emphasizes how much they love the victim. Number 49. Abuser constantly criticizes the victim. In tension building phase, incident explosive stage, honeymoon stage. The answer is A. In tension building phase, abuser constantly criticizes the victim. Number 50. Most poisoning take place in the home. True या false? The answer is true. आमे फर्स्ट एड रो 50 क्वेश्चन आंसर ऑलरेडी पढ़ी नेले. एबे आउ 50 टी क्वेश्चन आंसर पढ़िबा स्टार्ट करिबा. ओके. Number 1. The first aid was coined in which year? 1877, 1859, 1790, 1878. The answer is D. 1878. Friedrich S. March is the founder of modern first aid. Number 2. Which of the following does not stand for ABC of first aid? Airway, breathing, bleeding, circulation. The answer is C. Bleeding does not stand for ABC of first aid. Number 3. Burn injury involves skin, muscles and bones, blood vessels and nerves, all of above. The answer is D. All of above involves burn injury. Number 4. Which of the following is not a thermal agent of burns? Fire flame, steam, acid, nuclear radiation. The answer is C. Acid is not thermal agent of burns. Number 5. If a burns result in blisters on the skin, it is called a minor burn, second degree burn, first degree burn, third degree burn. The answer is C. First degree burn. Number 6. Which of the following body surface area does not come under the rule of 9 for burns? Since are the head and neck, each upper extremity, the genital region, the chest. The answer is C. The genital region. Question number 7. Which of the following is not true in case of thermal burn? Cold with water, remove clothing and jewelry, the remove tan or wax for the skin, ensure an open airway. The answer is C. The remove tan or wax from the skin. Number 8. Which of the following is not true for chemical burns to the eye? The options are immediately wash the eyes with water, continue wash the eyes for at least 20 minutes. After washing, cover both eyes with moistened pads. Use neutralizers such as vinegar or alkaline. The answer is D. Use neutralizers such as vinegar or alkaline is not true for chemical burns to eye. Number 9. Characteristic order of breath, clothing, vomiters, difficult in breathing, etc. are signs and symptoms of which of the following ingested poison? Options are acid and alkaline, aspirin, food poisoning, petroleum products. The answer is D. Petroleum products. Number 10. Activated charcoal should not be given in which of the following cases of ingested poisoning? Food poisoning, acid of alkaline, insecticides, petroleum products. The answer is B. Acid of alkalines. Number 11. Who of the following symptoms are due to food poisoning? Nausea, vomiting, abdominal cramps, diarrhea and fever, all of above. The answer is D. All of above are symptoms of food poisoning. Number 12. The drugs capable of producing stupor or sleep and often used to relieve pain are called uppers, downers, narcotics, hallucinogen. The answer is C. Narcotics. ଏହି ଅପସନ୍ ମାନଙ୍କ ମଧ୍ୟରୁ କେଉଁ ଡ୍ରଗ୍ଟିର କାପାସିଟି ଅଛି ଯେ ତାହା ୟୁଜ୍ କରିବା ଦ୍ୱାରା ଗୋଟେ ଲୋକଟି ଶୋଇଯାଏ ଏବଂ ସେହି ଡ୍ରଗ୍କୁ ବାରମ୍ବାର ୟୁଜ୍ କରାଯାଇଥାଏ ପେସେଣ୍ଟମାନଙ୍କର ପେନ୍କୁ ରିଲିଭ୍ କରିବା ପାଇଁ. The answer is C. Number 13. Which of the following snake is not poisonous? Options are rat or corn snake, cobra, crate and viper. The answer is A. Rat or corn snake. A corn snake is also known as red rat snake. This snake occurring in the United States. Number 14. If the break in the bone is incomplete in a fracture, it is called comminuted fracture, green stick fracture, angulated fracture, impacted fracture. The answer is B. Green stick fracture. Number 15. Which of the following is a sign and symptom of fracture of pelvis? Pain in hips, pain in lower back, pain in groin, any of the above. The answer is D. Any of the above. Number 16. If bone is broken at several places, it is called which fracture? Options are comminuted fracture, angulated fracture, impacted fracture, green stick fracture. The answer is A. Comminuted fracture. Number 17. The stretching or tearing of ligament is called a fracture, sprain, strain, grating. The answer is B. Sprain. Stretching or tearing of ligament is called a sprain. Question number 18. Fracture of radius is also called which fracture? Colles fracture, strain, crepitus, green stick fracture. The answer is A. Colles fracture. Number 19. In hemorrhage, blood is dark red in color and flows steadily. It is likely a bleeding from artery, vein, capillary, both B and C. The answer is B. Vein. Number 20. Which of the following is not a sign and symptoms of shock? Thirst, blurring vision, face and lips become pale, pulse becomes lower and stronger. The answer is D. Pulse becomes lower and stronger. Number 21. Which of the following is the last resort to control external bleeding? Direct pressure, elevation above the level of heart, use of tourniquet, use of pressure point. The answer is C. Use of tourniquet. बेले ब्लीडिंग स्टॉप करिबार सबु किछि एफर्ट्स फेल हो जाए सेते बेले लास्ट रिजॉर्ट हेउछि एक्सटर्नल ब्लीडिंग स्टॉप करिबार यूज द टर्निकेट. ए टर्निकेट को कोठी यूज कले ब्लीडिंग बंद होई पारिबो? अप्लाइंग ए टर्निकेट above the bleeding wound. Number 22. Which application minimizes swelling and reduces the bleeding by constricting the blood vessels? Hot, cold, hot and cold, all of above. The answer is D. All of above. Question number 23. Which of the following is a one-man lifting method of casualty? The options are two-handed seat method, for and art carry, fireman's lift, chair method. The answer is C. Fireman's lift. Method of casualty or fireman lift soldier मान का क्षेत्र रे यूज करा जाए. Question number 24. Which of the following stretcher is used to lift casualties in an upright position like through a manhole? Scoop stretchers, Neil Robertson stretcher, Paraguard stretcher, both B and C. The answer is D. Both B and C. Neil Robertson stretcher, Paraguard stretcher. ए दुईटी जंकर इमेज मु देई दूची देखि नेबो. 25. Which of the following stretcher is used to lift casualties without altering their position, such as in spine fracture? Options are pole and convex stretcher, Paraguard stretcher, scoop stretcher, both A and C. The answer is C, scoop stretchers. यार मध्य इमेज दे देउछि देखिके बुझी पारिबो जे ए scoop stretcher कण. Number 26. A bandage is used to control bleeding, hold dressing, restrict movement of the body part, all of above. The answer is D, all of above. 27. A clean handkerchief is placed to dress the wound. It is called adhesive dressing, sterile ready-made dressing, gauze dressing, improvised dressing. The answer is D, improvised dressing. Number 28. Covering applied to the wound for its protection is called bandage, dressing, splint, sling. The answer is B, dressing. 29. Which method is used to bandage a finger with roller bandage? Options are figure of 8, simple spiral, reverse spiral, all of above. The answer is B, simple spiral. Number 30. A dressing is used to control bleeding, avoid further injury, prevent infection, all of above. The answer is D, all of above are used for dressing. जेमिति कि मो वीडियो फर्स्ट रे कही जे आमे ए वीडियो रे आउ 50 टी क्वेश्चन रो आंसर पढ़िबा जेहेतु वीडियो अधिक लॉन्ग हे जाउची सेथि पई ए 30 नंबर रे स्टॉप करूची आउ 20 क्वेश्चन एंड आंसर्स मु नेक्स्ट वीडियो रे अपलोड करबी जोटा कि बहुत शीघ्र आपण मान को पाखरे पहुंच